Yeah, I think there are a lot of myths and misinformation about how this gets done, and in one prevailing idea has been, well, how could they possibly figure out, who to release in the sentence population? Um, but we have to remember, and I think this is one of the reasons why the Supreme Judicial Court is focused on the parole board. There are people who have already been approved for parole, meaning the parole board and the DOC have determined that this person is a low risk, is not a risk to public safety, and should be released. And so we should be releasing those individuals. And for other people who have hit their parole eligibility date, the push has been to expedite those hearings and look at who is a low public safety risk and doesn't pose a threat to public safety and can be released. And again, the Department of Correction and the parole board do risk assessments all the time on individuals who are incarcerated. So they know who is a low public safety risk. And that also, I think there's a misunderstanding that low public safety risk means people who have not been convicted of quote unquote violent offenses, which can be possession of a firearm. Just to clarify that there's a big range there. But for a lot of the sick and elderly, we're talking about people who've been incarcerated for decades, who may have been incarcerated at age 18 or 19 for a violent offense, but 30 years later, they're still incarcerated. They're now infirm and elderly, and by definition, you age out of crime, around 30, 40 years of age, and and you become much more low risk. So the elderly in particular are some of the lowest risk people in the system. And then you add to that infirmity, there are many people who are very low public safety risk and should be assessed for release on that basis. Just because someone has been sentenced doesn't mean that they're not appropriate for release.